bit more about the topic. We did, she did someone from the same area presented a number of years ago um, about this. So welcome. It looks like we have two. You and Harrison are both presenting. So if you want to introduce yourselves, that would be great.
Yes, thank you so much. And Harrison, why don't you come online here?
Yeah, can you see
I am
me?
Whitney. Yeah, there he is.
Okay, great.
I am Whitney Mason, and I work with Harrison in the policy planning unit at MnDOT. You may be wondering what the Department of Transportation is doing here tonight. So we're about to tell you. We actually intersect a lot with Department of Public Health. So Harrison, I'll let you introduce yourself.
Yes, great introduction. Yeah, my name is Harrison Maxwell. I work at the Minnesota Department of Transportation with Whitney Mason. We're in the statewide planning office, and we're just here today to give you an update on the Minnesota Go Vision. And I think that's a good segue into the Whitney's presentation, where she'll give you more information.
All righty, I'm going to share my screen, right?
I think I probably need to make you co-host.
Okay. Well,
I'm also going to have to share my screen at one point as well.
Okay, I can make both of you co-hosts.
Thank you.
There you go.
All right. Are you seeing what you need to see?
We're seeing it, Whitney.
All right, great. I'm going to go to the first slide. All right. So first of all, as Harrison said, this is Minnesota Go. This is the state transportation vision for state of Minnesota. It's not just MnDOT. And the reason we're here today is because we are updating our vision, our Minnesota state transportation vision. We want you to know that there actually is a vision. We want your help in updating the vision, and we want your help promoting the survey if you're willing. We are going to take a Mentimeter survey here after a bit, if you're willing, and Harrison's going to help us run that. So this is our current vision statement. It says that Minnesota's multimodal transportation system maximizes the health of people, the environment, and our economy. And what it does is recognize that transportation is not an end in itself. Our job isn't to build bridges and roads. It's our job to build healthy communities, give people access to where they need to go and such. And so this vision statement recognizes that. We have an Office of Sustainability and Public Health actually at MnDOT. And our agency operates on big plans. Those big plans are guided by our vision. So the biggest policy plan we have, the highest level policy plan we have, is the statewide multimodal transportation plan. And Harrison and I are charged with working on that plan. It informs our modal and system plans. So our modal plans would be like bicycle plans, walking plans, our investment plans for all of that, our transit plans, amongst others. But that is the reason we often work with the Minnesota Department of Health, is because active transportation, is a health interest. Also, our goals for reducing pollution and supporting climate efforts in the state also intersect with our work with Department of Health. Interestingly, listening to the previous presentation on people experiencing homelessness, we do also have a plan that we do in coordination with the Minnesota Department of Health and our Department of Public Safety. It is called the Strategic Highway Safety Plan. It is entirely safety focused, and safety we look at safety with a broad lens, which is why we partner for that plan with Department of Health. And it does take into account homelessness, people experiencing homelessness. So you don't need to know this. Our timeline is quick and short. We're doing a lot of intensive engagement right now. We hope to have a new vision by the end of, by a year from now, easily. We're connecting with a lot of Minnesotans. we want people to have the opportunity we want to meet people where they're at as much as possible. The state of Minnesota supports translation of English into Spanish, Hmong, and Somali. So we offer all those language translations for people when taking the survey. We have handwritten options. We have online options, which we have something called Let's Talk Transportation at Minnesota. It's our online platform for engaging with any of our projects that are out there, also with any plans that are being developed, including this one. And we have our Mentimeter surveys like we're about to do with you, if any of you are familiar with Mentimeter. And we reach out to community-based organizations for engaging particularly with underrepresented populations. That's our Go Mobile. We take that to a lot of our events. It's an opportunity for kids to color on the Go Mobile, and maybe parents will take a survey. We also have started doing a little origami butterfly folding because we promote pollinator species planting in our rights of way, and want people to know about that. I just realized I'm a little dark here. I'll give us some more light. And then we have an activity called Postcards to the Future, where maybe a child is old enough, they don't want to color on the Go Mobile, they don't want to take a survey, so they can fill out this postcard that says, in 50 years in the future, I want transportation in Minnesota to be, and they can put anything they want there. They can even draw a picture, which they sometimes do. Sometimes they leave a little chocolate behind on the card, but then they can put their postcard in the mailbox like you see on the table there, put up the flag, and their wishes will be sent to the future. Greater Minnesota events, we try to hit Greater Minnesota as well as Twin Cities, try to strike an even balance between those. Those are zoomed in Twin Cities area event locations where we go with our table and our tent and our Go Mobile and interact with people. So we've been pretty ambitious about that the last couple of months. All right, without further ado, we're going to try to have Harrison share his screen. If you could go to menti.com or use the QR code there, it will take you directly to our survey.
So he put a link in the chat too. We
I
can use that.
did. Yes, thank you for sharing that.
Great work.
Okay,
So
can
I'll turn it
everyone
over to
see
Harrison.
my
Sure.
screen right now?
Yep, looks good.
Looks good? Okay, great. Okay, everyone, thank you for participating in this Mentimeter. This is our survey for Minnesota Go. We're just going to ask you some multiple choice and open answer questions, and just kind of get your feedback on the future of Minnesota and transportation system in Minnesota. So first question is, what is one thing you like about Minnesota's transportation system?
So are you asking people to click on the link and then type it in and then it will automatically show
Exactly.
up on the screen?
It will. So if you have a phone or device with you, you could just go to menti.com, and then if you see the code on the top, you could enter this code, or that link I hit in the chat, or I put in the chat, you can click on that and it'll take you directly to the Mentimeter. And if you have any more questions, just feel free to ask.
Or can people just say out loud if they want to say and you could type it in?
It looks like we have a good number of people on here.
We do. We have
Good,
14 at
good.
the moment.
Yep.
Great.
Yeah, we really appreciate the participation. We have some great answers coming in as well.
Harrison and I were both excited to hear responses from y'all because oftentimes we're presenting to transportation professionals, and you are a completely different realm, which I think will give a completely different perspective, and we're seeing some of that here.
We're talking about demographics later, and
Mhm.
this is gonna be great. We get to some very different answers, and it'll be great for the work that we're doing, creating our vision. Okay, looks like we're getting a lot of responses. I'll move on to the next one. I'm already moving on to the next slide, but even though I move on, you still have time to be able to answer. Next question, what are the biggest transportation challenges that you currently face? And you can select up to three. Some great responses coming in. Great. We'll be moving on. What aspects of transportation are most important for your future needs? Again, you can select up to three. Great responses. Thank you. Okay. And great participation too. This is like the most participation that we've actually had in doing this presentation. Looking towards the future of Minnesota, please select the three most important goals that our transportation system should help achieve. Yeah, nearly everyone is participating. Whitney, I think it's like usually 60, 70, maybe 80% of participants that are actually responding. So the fact that we're getting 14 out of 15 is great. So I really appreciate it.
Oh, this one is very different than what we usually
Very
see.
different.
Very
Yeah.
interesting.
Honestly, in some ways it's like the reverse of
Mm-hmm.
yeah, what we normally get. This is great.
Mm-hmm.
Okay. What is one change? This is open answer, open response, or open answer. What is one change that you would make transportation work better for you? That would make transportation better for you. And this could be really anything.
I'm curious if anyone wants to elaborate on more support in rural communities.
I was going to say the same
What
thing,
what
Whitney.
that yeah, what that might look like. You could type it in the chat. You're welcome to come online or not say anything, but I am curious, and so is Harrison.
I
Yeah,
put
someone that I
that.
also
Oh,
oh, continue.
sorry.
Sorry. No, 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 continue, continue.
So I put that. I live in a small town of about 900 people, and there are a lot of like I would consider it like a food desert.
Yep.
There's nothing, you have to go 15 miles, and people don't because they're the people that don't have transportation. There are some community bus routing systems, but it's very small in so a lot of people just don't leave to get access, like access to healthcare. So I just feel like there could be more options. Um, I know that funding makes that more difficult, but I just feel there should be more options for people needing to get to places.
Are you aware of transit on demand? Most, if not all, communities have some form of transit on demand, and it isn't just for senior citizens or people with impairments. It's for everyone.
I've
Most
never
people,
heard of it. No.
yeah, most people do not know that. If you wanted to contact either Harrison or me after this, I'd be happy to put you in touch with somebody at MnDOT who specializes in that. We don't provide the services, but we do work with the people who do provide the services in various parts of the states. And it's different operators depending on where you are. But
Is it more like people are volunteering their services?
no. These are paid staff. Usually, I think they operate, they're sometimes operated by cities, they're sometimes operated regionally. I am not an expert in it, so I don't want to misguide you, but I can point you to people who are experts.
I just,
And
you
so
know,
can
I
Harrison.
Yes.
found out more about it when my dad had a lot of health issues and then going home and wasn't able to drive for a few months and like trying to like navigate that like with family and friends and still like and not having for him to get to his essential appointments. It was a big struggle finding resources.
It was the
Yeah,
same thing for me. I live in rural Minnesota, and my little brother also he has a disability that prevents him to be able to drive, and it's hard for him to get around. He has to go to medical appointments as well, so we had to use similar services, and it is difficult, but there are a lot of resources out there. Like Whitney said, we can point you to the right direction, so you'd be able to
Awesome.
get information.
I am an
So would you be willing to drop some of that in the chat or send it to me afterwards and I can send it out with the follow-up email too?
It's really dependent on where you live.
Yeah.
I mean, we can give you the name of somebody who works with transit at MnDOT, but if you actually just do a Google search of rural transit in Minnesota, you should be able to plug in your zip code and find what you need.
Yeah,
I
it's
have,
different in each region of Minnesota,
yeah,
different parts of Minnesota.
I can noodle around while you guys are going through the rest of the survey and see what I can find here.
same issue here. I live in Venice Heights and I have health issues. And it was a struggle for me the days that I cannot drive. I have to take an Uber and I end up paying like over $150 a day just, to manage a couple of appointments.
Thank you for sharing that. I actually am finding something here that I am going to drop a link to in the chat. It is from our MnDOT website, and it's a Find Your Transit Provider page. I think this is the last question before our demographics, right, Harrison?
It is, yes. So what else would you like to share about transportation in Minnesota? And this is meant to be broad.
We are currently updating our Greater Minnesota Transit Plan, which is where we work with our providers and other stakeholders to improve services, to improve coordination from one region to another, to improve our websites, and a whole host of resources. But if you click the link that I did put in the chat, you should be able to type in your zip code and find who the transit provider is in your area. Also, if you have questions, there are tabs which will lead you to our transit contacts at MnDOT, who are the experts.
Thank you, Whitney. Okay, I think we're going to move on to demographic questions. So the questions in this section are optional. You don't have to answer, and it'll be a little different than the previous slides. So when the question comes up on the screen, your answers will not populate. Um, but this is really helpful to us, be able to get a cross section of people throughout Minnesota. So what zip code do you reside in? Next question, what race/ethnicity best describes you? And select all that apply.
Thank you for doing this. Just helps us know that we're hitting a representative sampling of the population of the state of Minnesota.
Exactly.
And that we're reaching all across the state.
Yep. Trying to capture all the voices, right, Whitney?
And capture all the voices.
Okay, everyone. Thank you for sharing your thoughts. We really appreciate you entertaining our presentation day and taking the survey. Again, this was the most participation we've had in all the presentations. We had 16 people here, and mostly all the slides was 15 out of 16. So thank you so much.
Yes, thank you so much. And as I said, so the three things we were going to do is let you know that we do have a state transportation vision, entire state of Minnesota, not just MnDOT. We wanted your help, your feedback, which you just gave us. And the last thing we're going to ask of you is to promote this survey that you see here. I dropped a link in the chat to our Let's Talk Transportation pages. That's where that QR code on the screen goes. And Erica, did I share this with you previously?
You did. You shared a different version of it, not this one, I think.
I mean, like before this meeting, did I send it to you through an email?
Yes, you can,
Oh.
but I don't think it was the whole thing. It was just part of it. So if you want to send it again, you can do that too.
Okay, all right. I was just going to ask Erica if she would send that out to y'all.
Yes.
And just ask any Minnesotan you know if they would be willing to take the survey. We would certainly appreciate it. We want, as we say, we want to hear all the voices.
Yeah, I would really encourage you to reach out to local public health and other people too to get the public health perspective in your
Oh,
survey.
I should reach out to the SHIP coordinators. I did present to the
Yes.
SHIP coordinators, I guess in August. So I think I actually have checked that box. I think they do have that information, and we're asked to send out that
Yeah.
information.
And this
And
is
some of the-
Cheryl,
Oh,
and
go
this
ahead.
is Cheryl Lee, and I work with SHIP at MDH. And
Mhm.
I can have that send it out again as well, just to
would
remind
be-
people. Yeah.
Yeah, that would be fantastic.
Yes, thank you so much.
Mm-hmm.
There also is the CHS mailbag, and you might want to put it in there that goes out to local public health. You can find it online if you don't get it. It's called CHS mailbag.
You know
And
what? In order to help you, I'll have Ellen Pillsbury put it in the CHS mailbag.
that is fantastic. Yes, I work with Ellen all the time. I love
Yeah,
Ellen.
yeah.
Yeah.
All right. Well, thank you all. We appreciate you.
We have a few minutes if people have questions they want to ask.
We check with our executive director. If she agrees, we can run the survey together during our big meeting, you know, where most of the people are present.
So
Thank you.
That'd
how
be
long
great,
is the survey
Hyatt.
gonna, how long is the survey gonna be open?
We're wrapping up at the end of September, so we don't have a lot longer, but we do have
Okay.
some time. We will have a phase 2 survey. Well, actually, it probably won't even be a survey. What it will be is in February or March, we will have a drafted vision plus guiding principles that we will put out for people to react to. So, so we'll have a phase 2. But yeah, this one ends at the end of September.
I did send it out with the email for this meeting, the link to
Oh,
this
great.
page, so people have that. And then I think what Hyatt was referring to is we have a conference, spring conference,
Mhm.
and the call for presentations will go out. This might be something you might want to present on, or have a table at the conference that you can have people come by. I don't think
Sorry,
I don't think there's a date yet, is there, Hyatt?
oh, okay.
We are near getting the date. It's we are between 2 dates, so it's going to be very soon. But during the month of maybe April, next April.
Sorry, did you
April.
say April?
April, yeah.
Yeah, we
Usually-
will, that will be too late for this process, I'm afraid. We do plan to have a final draft at that point, but
No, but
thank
for
you.
the survey, we can get you the results just because we are meeting every other week. We are meeting like 3 times basically, like the co-chairs together, and then with the whole group, the of the committee, organizing committee, you know, every other Wednesday.
Oh, thank you. That would be fantastic. Yeah, if you just go to our online survey, it'll tally everybody up in real time. Harrison and I'll have the results right away.
Also, Whitney, you know, with our MPHA conference, you might want to submit an abstract to talk about the results that you have from what you've learned from the survey.
Oh, that's a good idea, isn't it? I mean, and also maybe just generally we could have a panel to talk about different transportation initiatives that align with your health priorities.
Yes, yes.
Yeah, because we really do have a lot going on.
What you mean by panel? Is it like a round table or a panel, right?
Yeah, a panel discussion or a roundtable.
Yeah.
Yeah.
Okay. Yeah.
Mhm.
Yeah,
Yeah.
I think it would be great. And then I think, you know, having the MDH person, is that Ellen Pillsbury, bringing that public health perspective in and bringing in an equity perspective,
Yeah.
Yeah.
it would be a nice presentation.
Yep.
Well, thank you again for presenting. I hope this was helpful.
Harrison's got his hearts going. Thank you all. This was
Very
Thank
helpful.
you.
really
Thank
nice.
Thank you for joining us.
Yes,
So, any last comments?
I was just going to say goodbye. Thank you.
Thank you. You're welcome to stay on for the rest of the meeting too. I'm gonna pass this over to Sunava, and you can take the next part.
Hi everyone. I have my dog away, so that would mean I'm working. I am going to give a brief presentation for Hispanic Heritage Month, and talk about some public health leaders who are of Hispanic descent, and then you can share if you know of anyone, and we can have a brief discussion. It won't be too long because I know we only have less than a half an hour left here, so let me just pull it up here. Okay. Okay, can everyone see my screen?
Yes.
Okay, great. Now will it move ahead? Okay. So first, I'm just going to go over a brief little, notes on language. So it is officially called this month, which is from the 15th to the 15th. So not starting at the beginning of the month. Is National Hispanic Heritage Month. It is specifically Hispanic, but there are people that may overlap. And so we're going to go through a few terms. Hispanic is people who speak Spanish or are descended from Spanish-speaking populations. And another term that is commonly used is Latino or Latina, which are people from Latin American descent, regardless of which language they speak, and that includes people from Brazil, who speak Portuguese. Other terms that you may hear are Latine or Latinx, which are more inclusive and gender neutral. And other terms that are also used are Chicano, Chicana, Tejano, Islenos, Boricua, Afro-Latino, and more. And if you have other terms that you know of that I missed, feel free to put them in the chat or let us know later. As I said, this is National Hispanic Heritage Month, which was established in 1968 under President Johnson as a week-long event and then was expanded to 31 days under President Reagan. It is observed from the September 15th through October 15th, which is in contrast to a lot of the other months that start on the 1st and the 30th or 31st. And this is specifically because it started as a week, and also because the dates were chosen to honor Independence Day celebrations in many Central American countries. There are over 60 million people in the United States that identify as Hispanic or Latino. There can also be a discussion about the census and how that is decided, especially in surveys like the one we just took. So it's an ever-changing discussion. Some key health topics that impact Hispanic people include access to preventative care, language and cultural barriers that may impact their ability to receive care, and lack of insurance coverage, which can contribute to health inequities. In 2020, 18.3% of the Hispanic population was not covered by health insurance, compared to 5.4% of the non-Hispanic white population. And there are also, as you probably know, inequities in COVID-19 cases and deaths within the Hispanic population. And then now moving on to some public health leaders. This is Dr. Helen Rodriguez Trias, who was born in New York City of Puerto Rican parents. She's a public health expert, women's rights advocate, and pediatrician, and was the first Latina president of the APHA and founding member of the Women's Caucus and Hispanic Caucuses. And she was awarded the Presidential Citizens Medal of Honor. This is Bambi Salicedo, who was formerly doing health education at the Children's Hospital of Los Angeles, and notably founded and is the president of the Trans-Latin Coalition, which advocates for the specific needs of Trans-Latin community. This is Dr. Carlos Juan Findlay, who is an epidemiologist from Cuba and who notably discovered the nature of transmission of yellow fever. He was nominated for the Nobel Prize a number of times and was the chief health officer for Cuba in the 1900s. This is Rafe R. Luquis, PhD MCHES, who is a director of behavioral, a director at the School of Behavioral Sciences and Education and professor of biobehavioral health at Penn State, Harrisburg. He wrote a book, or is a co-editor of the book, my apologies, Cultural Competency in Health Education and Health Promotion. He's also the 2023 SOPHE president, which is the Society of Public Health Educators, and primarily researches cultural competency in multicultural health, public health education, and health promotion. Okay, and finally, this is Cynthia LeBron, MPH and PhD, who is an assistant professor at the University of Miami, was the president of the APHA's Latino Caucus for Public Health, and focuses on prevention inequities in maternal and child health and obesity. Okay. Now it's time to share. If anyone has other public health figures that they'd like to talk about, or any other discussion items related to Hispanic Heritage Month. You can either put it in the chat or come off mute.
This is Cheryl Lee. One person that I'd like to acknowledge is Dr. Veronica Fuentes, who works at Hennepin County Medical Center. She established a program called a Keep Out of Tea, and that's working with adolescents and then families and mental health. And so just bringing that mental health and healthcare together, and actually really working hard to bring families together as well. So she's won a lot of different awards in adolescent medicine, and is right here in Minnesota.
Great.
We have a number of Latino organizations in Minnesota. And I think we can highlight some of the executive directors. One of them is the director for the Minnesota Council on Latino Affairs, Rosa Tock, who's been in that position for a long time and is an advocate on the state level for a lot of the concerns. So I think, she's a really important person. And I'm the one that put in Helen Rodriguez Trias as she was a mentor to me when I was young and starting out working. I actually knew her when she was doing her committee against sterilization abuse and for reproductive rights. And she just spent time talking to me and sharing all her wisdom with me. And I thought, she was at the forefront of taking action and having a voice for women's rights and the rights of Hispanics. And as she said, she was, the first Latina president of American Public Health Association. So she shared her wisdom with lots of people. Yeah. Sunniva, you want to share your last page here?
Oh, yeah. This is just some resources. I can copy them and put them in the chat, which includes the term discussion and definitions came from Fenway Health, and they have a lot of other resources on their page, which they just updated for 2025. There is on PBS, there's some resources about Hispanic Heritage Month, as is, I believe, it's the HispanicHeritageMonth.gov has a lot of resources. And it was, I believe, updated this year, which is good. So I will, put those in the chat. As does Sophie. Sophie has some resources on Hispanic Heritage Month as the Society of Public Health Educators.
So notably, what was missing from that list are federal government resources. I think we had the Hispanic History Museum listed, National Museum of American Latino, part of the Smithsonian, but a lot of the other resources unfortunately have been taken down in the last year, so they're no longer available. So I just wanted to point that out. Maybe they'll be back one day, but for right now, they've mostly been taken down to do that. So thank you for that presentation. And I just wanted Sunniva now to just take a few minutes to update us on the Policy and Advocacy Committee and the work that they're doing.
Yes. And I have to remember what we talked about in our last meeting. We discussed the policy brief process, which is in editing, drafting, I suppose. Which if you have any that's something you want to be a part of, I can share. You can email me and I can share the document with you. People are just leaving comments or having comments at our meetings. Our meetings are the second Tuesday of every month at noon. So it is in the middle of the workday. But you can also have your voice heard online. We are also developing our public policy platform for the next little bit, I believe next year. So that is being developed. I don't think there are any specific action items on that right now. But I will check and for sure let everyone know at our next meeting.
So thanks. One of the other things that we're working on is the connection between voting and health. And as most of you know, that we're going to be engaged in um, non-federal local elections. And we realize that it's really important for people to understand the importance of voting in those elections, and that includes school boards and other elections. So we're actually coming up with a couple of different documents that I'll send the link out so when we have them. One, there'll be an article in our newsletter too, which only goes to members, but I can include that when I send it out. And if you're going to any forums or debates, there's a page on the Sophie website that's questions to ask candidates or legislators. So you can go on that and look at that. And there's also going to be an MPHA coffee chat on October 3rd in the morning. I think that Sunava is going to be leading. So we'll send out the information on that. So people are welcome to join on that too. This is, as always, elections are really important. And it's an initiative that MPHA has been doing for a number of years, just in small action steps. We are looking for more people to join us on this. So if you're interested, you can email the health equity at mpha.net and express your interest, and then we'll get back to you. Most of the work, as I said, in MPHA is volunteer work. So it's people have ideas and you have something that you think could be worked on, just let us know and we'd be glad to partner with you on that. So that's important to do that. Then we just got an email today. I just wanted to let people know that the Minnesota Breastfeeding Coalition is accepting applications for the board of directors. And if you go to their website, Minnesota Breastfeeding Coalition, you can go and see the application form there and apply for that. It's a really good organization, and we'll probably have them present at a future meeting here too. So now what we'd like to do is open the floor up. If people have things they want to share about their work or how things are going, please let us know.